Welcome to Your Fantastic Mind. I'm Jay Watson. Every 40 seconds, someone in the United States has a stroke, a brain attack. Every 3 minutes and 14 seconds, someone dies of a stroke. Now, the vast majority of strokes, 87%, are ischemic, meaning blood supply to part of the brain is blocked or reduced. The other type of stroke, suffered by 3.4 million people each year, is the deadliest. A hemorrhagic stroke is when a weakened blood vessel ruptures and bleeds into the brain. Now, in many ways, this devastating stroke has been hopeless until now. Physician scientists at Emory University have come up with a groundbreaking game changer set to revolutionize the field, saving countless lives on a global scale. Watching a soccer game at his children's school, Perry LeBlanc had no idea of his luck. He didn't feel lucky as the worst headache of his life hit.
If I could just get a couple of Advil and a Coke, I'll be fine.
LeBlanc went to the bathroom but did not come out.
Called my son and I said, "Can you go in the bathroom and see if Daddy's okay? Because he's not coming out, I'm waiting." And he came out and said, she couldn't get him to open the stall. And we needed to get help. So the security people broke into the stall and brought him out and put him in the ambulance.
The first hospital quickly transferred him when they saw he had a bleed in his brain, a hemorrhagic stroke.
They then took me to Emory, and that's where, by God's grace, Dr. Padilla was with this procedure. And, you know, as I told him the first time I met him, he was the hands of God that not only saved my life, but gave me the quality of life we have.
It's all a blur, but I do remember a doctor coming in the morning and saying he does some type of trial, and would I be willing to try?
This surgery that Cheryl LeBlanc said yes to saved her husband's life. It was from a trial named ENRICH, Early Minimally Invasive Removal of Intracerebral Hemorrhage. Before ENRICH began at Emory in 2017, options for hemorrhagic stroke were limited, and the best treatment option was unknown. The surgical procedure studied in the ENRICH trial did for Perry LeBlanc what researchers have been trying to do for decades. It safely evacuated the blood from his brain, and he recovered and went back to work, back to his life. Hemorrhagic stroke statistics show how remarkable that is. It is the deadliest of strokes. 51 to 65% of people die within the first year, many within the first few days. 6 months after a hemorrhagic stroke, only 20% of patients are expected to be independent.
That's the clot in the brain.
Head of Emory Neurosurgery and co-principal investigator of the ENRICH trial, neurosurgeon Dan Barrow.
The type of stroke that we're dealing with the ENRICH study is a spontaneous hemorrhage into the brain that's not from an aneurysm or a blood vessel malformation. It's when it happens spontaneously, and the underlying cause of that is not entirely understood, but the most common condition that predisposes people to this is chronic hypertension, chronic high blood pressure. The high blood pressure over time damages small little penetrating vessels that provide blood deep into the brain and weakens them, if you will.
Many studies attempted to use surgical interventions for hemorrhagic stroke, but none of them were shown to be more effective than best medical therapy, which involves stabilizing patients with medicine and close monitoring and taking more of a watch-and-see approach. Surgery is often a life-saving last resort.
If you think about it, somebody's got a blood clot in their brain. Intuitively, that seems like it ought to be a surgical disorder. If you've got a blood clot in your brain, it's got to be good to take it out, right? Well, it turns out that in medicine, what intuitively seems to be the right thing to do isn't always the right thing to do.